probably been to a hospital where the doctor spent more time staring at a computer than looking at you, right? That computer is running Epic Systems, the software controlling American healthcare. Today, I'm showing you exactly how this system works and why it matters to you. Let's dive in. Epic Systems handles 280 million patient records worldwide. Look at this homepage. You can see they're showcasing AI, genomics, and interoperability. Notice how they say, with the patient at the heart. That's their main philosophy. Let me show you the key sections that actually matter to you. First up, Epic Share. This is where hospitals share best practices. Think LinkedIn for healthcare workers. You can access tons of training videos and documentation here. If you work in healthcare, this is where you learn tips and tricks from other Epic users worldwide. Epic Research publishes real studies from their massive patient database. Look at this recent study about sepsis in infants. This research directly changes how doctors treat patients. This isn't academic fluff. This is actionable data affecting your healthcare right now. Epic Cosmos links 625 plus hospitals and millions of patients. When researchers need massive health data, this is where they get it. See these numbers? That's why Epic's research is so powerful. They have data from almost everyone. Now the part you actually use, my chart. Let me show you how this works. You choose your state or healthcare provider. Let's pick one and see the login screen. Once logged in, you can view lab results, message your doctors, schedule appointments, manage prescriptions, add family members, connect wearable devices. This portal follows you across different hospitals. That's the real power. OpenEpic is their API platform. This lets other apps connect to Epic data. See all these developer tools? This is how your fitness apps can sync with your medical records, or how telemedicine platforms access your Epic data. Epic User Web is for healthcare professionals and IT staff. You need special access here. This is where hospital IT teams get training materials, system updates, and technical support. Think of it as the professional backend. Now, let's see Epic's different software types. Look at these categories: standalone specialties, custom modules for dental, cardiology, orthopedics, health systems, complete hospital management, post-acute care, rehab centers, nursing homes, payers, insurance company tools, patient experience, appointment scheduling, test results, convenient care, urgent care, retail clinics, life sciences, drug research, clinical trials. Each one is tailored for specific healthcare needs. Epic is developing 200 plus AI features. We're talking AI scheduling that books appointments automatically, AI scribes that write doctor notes, smart alerts warning about patient risks. This is reducing doctor burnout and improving patient care. Here's why your records follow you everywhere. Epic's interoperability. 625 hospitals connected to TEFCA in 1 year. When you visit an ER in another state and they know your allergies, that's this system working. Epic doesn't list prices publicly. See this Contact Us section? You need custom pricing based on organization size. They have different contacts for media inquiries, patient questions, consultants, vendors. Here's what this means for you. Epic affects every hospital visit. That seamless experience when your records appear instantly? Epic. Those patient portals that actually work? Epic. The AI helping your doctor make better decisions? Epic. Epic Systems is the invisible backbone of modern healthcare. 280 million patients, 625 plus hospitals, and growing fast. Whether you're a healthcare professional wanting to understand your tools better, or a patient wanting to know why healthcare works the way it does, Epic is the answer. Hit subscribe if this helped you understand healthcare IT, and let me know in the comments what other healthcare systems you want me to break down next.